hosted by Oregon Physicians for Social Responsibility in conjunction with the Oregon Justice Resource Center. And we're so excited to be working together on this issue. We'll start with just a little bit of housekeeping and logistics, and then we'll get started right away in with the presentations. And there will be plenty of time for question and answers. So those of you who are in attendee or listen only mode, you'll have an opportunity to use the chat or raise your hand to ask a question after all of the presentations are over. And I want to give a quick shout out and thank you of appreciation to Fingers Crossed Interpretation. Steffi is here, as well as Risa, who will be taking turns doing ASL, American Sign Language interpretation, so that if there are any deaf or hard of hearing attendees or folks that want to watch this recording afterwards, it will be possible to have full accessibility. Thank you very much, and please do think of Fingers Crossed Interpreting if you have access and accessibility needs. So my name is Damon Mott-Story, and I am the Healthy Climate Program Director at Oregon Physicians for Social Responsibility. And guided by the values and expertise of medicine and public health, Oregon PSR works to protect human life from the gravest threats to health and survival. And we became increasingly concerned about the health crisis of COVID-19 in state prisons as we began to start hearing more about outbreaks at state penitentiaries and facilities, and now a terribly high number, I think it's now gotten up to 8 or how many presumed deaths from COVID-19. We'll hear more about that soon, but this has become an issue that we feel deeply passionate about and want to educate our members and the broader public about. Both what is happening and what we can do as health professionals and public health advocates to make a difference. And so I'm going to do a couple more introductions here, and then we'll proceed with the rest of the program. Yuvia, would you please introduce yourself?
Sure, thank you, Damon. My name is Yuvia Morello, and I'm the Energy Justice Organizer with Oregon Physicians for Social Responsibility. And as Damon mentioned, we're just really excited to be here with our community partners, Oregon Justice Resource Center, for us and for the community to learn more about why we feel mass incarceration is a public health issue and how our Oregon state prisons at this moment really exemplify that. Yeah, as Damon mentioned, we'll be fielding questions in the chat, and then we'll have a question and answer time at the end of the webinar. So you can also use your raise hand option to let us know, and you can ask the question in person. But thank you everyone for being here tonight, and thank you Oregon Justice Resource Center.
All right, Bobbin, would you please introduce yourself?
Yeah, hi, my name is Bobbin Singh. I'm the Executive Director of the Oregon Justice Resource Center. And I just want to thank OPSR for hosting us and hosting this conversation today. And I get to join colleagues from my organization, Julia Yoshimoto, who's the Director of our Women's Justice Project, Juan Chavez, who's the Director of our Civil Rights Project, and Alice Lundell, who's the Director of Communication for our organization. And they'll each speak a little bit about the work that they're doing and why I think we are so excited about being able to partner up and collaborate with OPSR and engage with its membership, because more and more what we're seeing is the need for reframing the conversation of mass incarceration around public health, or where public health is centered in how we're talking about community well-being and even public safety. So we're just really excited to, start this conversation. For the past month or so, we've been, or a little bit longer now, in active dialogue and conversations with both Damon and Yuvia, and just continuing to try to identify ways in which we can partner and work together and work on issues together. And hopefully this will give, our conversation today will give a little bit of insight into the work that we're doing, but hopefully will prompt more questions than anything else. And some curiosity that we can explore together, hopefully as partner organizations. So I'll start off just giving an introduction of our organization and our work, and then I'll hand it off to Julia and Juan and then Alice to let them talk a little bit about their field or portfolio that they work on within our organization. As I mentioned, my name is Bobbin Singh. I'm the founding executive director of the Oregon Justice Resource Center. I co-founded this organization in 2011 after graduating from law school. I was an older student going to law school, and a combination of both being fairly certain about what it is that I wanted to do and also the job market. We decided, me and my colleague that co-founded this, Aaron McKee, decided to incorporate OJRC as a nonprofit as we graduated from law school, and building off work that we'd been doing for a few years in law school ourselves. We were both interested in criminal justice and civil rights and immigrant rights work. And at that time, our law school wasn't providing any year-round opportunities for students to work on these issues. So while we're in law school, we developed opportunities for law school students to work on these issues. And from that sort of grew out the ideas or the seeds of OJRC. And over the past 10 years, we are now entering our 10th year. We've grown the Oregon Justice Resource Center to a statewide public interest law firm that operates 5 distinct legal service programs. But for our organization and the legal services that each one of our programs offer, the individuals that we provide legal services to would likely not be able to get legal services. So all our work is done pro bono. All our work is primarily in the gaps or where people aren't already getting legal services in the state. And we're the only legal organization that's actually involved in the entirety of the criminal justice system. So we work with clients from arrest through reentry, and people who have been harmed by the system or state actors, basically who are not being cared for by the system is another way to look at it. And so this gives us a unique perspective. Like, we get an understanding of the experiences of people going all the way through the system and issues that they're facing. Many of our policy or reform ideas actually emerge from the issues that we're seeing with our clients. And I think for us, that gives us, again, a unique position and a unique voice when we're engaging with policymakers or system stakeholders. Because while the issues that we're talking about may not have, big, broad mass appeal, there are issues that are more nuanced that, if we're able to reform or change or repeal, would have profound impacts on people being able to live with greater dignity throughout the system, or be treated with greater dignity throughout the system, or be able to come back into the community and participate more fully in our system in a way that's, with a lens of more compassion and support. So, the organization itself, I think, at its core is about confronting mass incarceration in all elements and aspects of it, and challenging the ideology and sort of the ideological assumptions that have propped up mass incarceration for so long. And I think one of the biggest things that we see is most of the policies that have been created in our criminal justice system or criminal legal system has not been really grounded in any type of social science or medical research. Most of the policies that we encounter or people are having to confront are usually or typically policies that have been created out of what we call like the politics of fear and anger, frustration, racism, bigotry, prejudice, sexism. And so for so long, those are the things that have sort of propped up our system. And those are the reasons why people are serving sentences in our prisons and our jails. Most of it is sort of framed around this idea of public safety. And I think what that unfortunately does is create this split, this dichotomy of this idea that you have to be safe from something or you have to fear something. And I think what we're trying to do as an organization is reframe the conversation around community well-being. How do we work to improve the health and well-being of our community members? So when there is a public safety issue, when there is someone that has committed a harm, it's not typically because that was their desire, like they are built that way. There's usually a confluence of events or circumstances that resulted in this action. And so I think it's for us a burden and our obligation to look more holistically at individual lives and kind of figure out, there are ways, I think, as a community, we can begin to address those underlying root causes that may have caused that sort of criminal action. But if we address that root cause, then we're more likely to actually work on the community well-being, the well-being of that individual, and hence the well-being of our community. When our neighbors, our community members are doing better in our community, both from an emotional, psychological, and physical health standpoint and economic, then we're better. That's just, I think, how sort of the interconnectedness of our communities and our lives are at this point. And so I think the things that, you know, we work on, the 5 different projects that we have, is the Women's Justice Project, which Julia will talk about, but that primarily is focused on working with women who are currently incarcerated at Coffee Creek Prison and helping them with civil legal services. Our Civil Rights Project, which Juan directs, and what he primarily focuses on are conditions of confinement issues at jails and prisons, often involving medical issues, and then law enforcement practices out in the community. So our organization's been, through Juan and our Civil Rights Project, involved with a lot of the law enforcement issues that we've been dealing with for the past 100 days, 100+ days. We run the Oregon Innocence Project. So we represent individuals who are claiming factual innocence. And since we launched in 2014, we've had 3 exonerations. Our most recent exoneration was this 2 months ago now, through a pardon that the governor issued to one of our clients, which was extraordinary. That's not something that's unique nationally, to be able to convince the governor to pardon someone. We run an immigrant rights project. So we have a state contract in which we have 2 immigration attorneys that are available to all public defenders in the state of Oregon. So when a non-citizen or someone that's here with status that is not a citizen is charged with a crime, that arrest and conviction will impact their immigration status. Under US Constitution, public defenders have to inform that individual client of the immigration consequences. And these are not easy things to be able to assess or analyze. And so the state, in understanding this Supreme Court mandate, interprets it by actually paying for 2 immigration attorneys or immigration attorneys to be available statewide for public defenders. Not all states do this. So our 2 immigration attorneys are available to public defenders to consult with them, to help them understand what the immigration consequences of an arrest or conviction will be. And the hope is to really work with the public defender and the prosecutor through the public defender to try to negotiate a plea to give that individual the best chance of remaining in this country. Most of the crimes or the alleged actions are typically, you know, actions of individuals who have been here for a very long time that just have done something, you know, unfortunately made a mistake or anything like, you know, something like that. So, you know, the sanction of deportation is too severe. And then our last project, it's a youth justice project. We have a team of individuals who support litigation and the defense of youth who have been put into our adult system. And then we work with individuals who have been prosecuted as adults and are serving life sentences essentially, or, you know, youth who are jubilifers is the sort of the term that people use. But our youth justice project was instrumentally or intimately involved in the passage of Senate Bill 1008 in 2019, which actually removed youth presumptively from Measure 11, even if they're charged with a Measure 11 crime. And so now all youth start off in the juvenile system before going into the adult system. Previous to 2019, if you were charged with a Measure 11 crime, youth would start off automatically in the adult system. And so there's dozens, if not hundreds, of youth that have been convicted in the adult system, and many of them serving very long sentences that will end up, you know, going from the juvenile system to the adult system. So with those 5 programs, you know, we get to deal or work with a variety or diversity of populations within our system. Typically, you know, these are populations that people have some sympathy or empathy towards. So women, children, youth, innocent individuals, you know, immigrants. So, you know, I think that also gives us an opportunity to be able to engage with system stakeholders and decision makers and the public, being able to bring to them a message that may resonate more clearly to them. Because not everyone may be totally against mass incarceration, but if we're able to engage with people around women, for example, or innocent people, we can bring them into the conversation and help them, you know, expand sort of their thinking on these issues and broaden them and introduce them to other subjects and issues. In addition to the 5 projects, the direct sort of legal services projects we have, we also work on more broader policy issues. So our organization has been very active in the anti-death penalty work. We work more behind the scenes, but we've been very active in, you know, supporting when Governor Kitzhaber was governor, the moratorium that he put in place, and when Governor Brown took over, the moratorium that she sustained and carried over from Governor Kitzhaber's administration. And we track very closely what's going on here in Oregon and nationally with the death penalty as well. And then we also track very closely cases going up to the Court of Appeals and Oregon State Supreme Court. And we often write amicus briefs. So we have an amicus committee, and an amicus brief is just a friend of the court brief. So when there is an issue of broader relevance than just to the parties themselves. So if the Supreme Court is taking an issue that we know will have a broad impact on all criminal defendants, and if that issue relates to, racial justice or, issues related to social science or medical research, we will write an amicus brief to the state Supreme Court trying to educate the justices on these issues and why we think they're important, but really trying to use social science and medical research as a way to introduce that information into the court, because not oftentimes the individual attorneys representing the client is able to do that in their brief. So we've been pretty successful with our amicus briefs. We've submitted, I think, over 40 briefs over the past number of years, and a lot of them focusing on mental health, intellectual disability, recidivism rates, sex offenders, racial justice issues. So a lot of issues that we're beginning to understand that there is this body of social science underneath it that better informs us on how we could better think about these issues and think about individuals who are engaged in sort of actions that they've been convicted on, and what are appropriate sanctions for them, like sentences. Are they disproportionate, proportionate, those types of things? How do we think about release and opportunities for release and things like that? So that's our organization in a nutshell as far as the totality of work. I think the simplest way to think about us is that, because when I describe the organization, it's, Alice is always trying to work with me on trying to develop an elevator pitch, and it's hard with the total amount of work that we're doing in all the different projects and programs. But fundamentally, what I would really like to leave folks with, at least as an introduction, is our organizations really focus on providing legal services to people going through the system who don't have access to legal services, and really trying to confront mass incarceration and work on issues when people have been harmed by the system. And so we're the only organization of our kind in Oregon, and really kind of west of the Mississippi. The organization that we really try to model ourselves after, or I've tried to use as inspiration, is the Equal Justice Initiative out of Alabama, or Southern Center for Human Rights out of Atlanta. And so really, I try to move past the labels of our projects and really think about our organizations from a value-based place, which is what is it that we're trying to accomplish. And as Juan says, his criteria for taking a case is fundamentally he just asks himself, is this okay? Is this okay to be treating people this way? And if not, then we need to do something. And that's really, I think, the place in which our organization is getting to, is really trying to look at cases and individuals and how the state is treating people who have been alleged to commit criminal acts or have been convicted, and really think about, how do we rethink about the treatment of individuals? How do we ensure that even if people are going to be held accountable and be sanctioned for this action, how do we ensure that dignity is maintained throughout the entire process and that people are never dehumanized throughout that process? And what I'll say is, right now the bar is extremely low as far as what is the treatment of individuals. And we can talk a little bit more about like what's happened in the past couple of weeks and since COVID. Juan can maybe mention some of that. But I just wrap up by saying our interest, I think, in partnering with OPSR has really stemmed from our experience with our clients and seeing how interrelated the things that led people into the criminal justice system are connected to public health or medical issues that either are underlying or drivers of the action that end up getting exacerbated by our current system. And I think for us, having public health professionals or medical professionals actually be out front and engaged in this issue will help us get to a cultural transformation that's really desperately needed within the system. We're really good at punishing people. We're really good at being, I think, vindictive and vengeful, but we're not really good at being restorative or healing. And I think there is a community of people out there, and I think many states are coming to this recognition that it's actually better for the community, both from a fiscal standpoint, but from a moral standpoint, to be more focused on the restoration and healing of folks. So we're just at the fledgling stages, I think, of that transformation. And so I think having OPSR involved at the very beginning and, while we're trying to push this is incredibly important, and just really excited to be here. So I hope that gave a decent overview for folks of what our organization does and sort of why we're here today. And so what I want to do is just hand it off to Julia, who's the director of our Women's Justice Project, to talk a little bit more about the Women's Justice Project and the work that she's been doing for the past 5 years and more, and maybe how she even got here, and then some of the reports that she's doing. What I'll say with the Women's Justice Project, of all our programs, it's the one project that actually captures the model of advocacy that we really think should be sort of not only within each project, but system-wide, which is like this integrative advocacy model where we provide direct legal services, we do public education, we do policy reform, and then we also do just broader advocacy and using in communications. And we use all those tools sort of together in order to help lift up a conversation. So as you're listening, I just hope you also pay attention to that sort of holistic approach that we're trying to bring to these issues. So I'll pass it off to Julia, and thank you again.
Hi, everyone. Thank you so much for having me here. Like Bobbin said, my name is Julia Yoshimoto. I am the project director for the Women's Justice Project. And I am genuinely excited to be in conversation with the Oregon PSR, to be talking about these issues from more of a public health lens. I'll talk more about the Women's Justice Project, but and the specifics of what we do, but we see the intersections of health-related issues in all aspects of our clients' lives, from how they got into the system, how they're experiencing the system, and how they're going to be sort of re-entering back into the community after incarceration. I started the Women's Justice Project coming out of law school. I was working with an organization called the Red Lodge Transition Services. And Red Lodge works with Native American women and men, but primarily with the women, assisting them with their transition out of the women's prison and back into the community. They bring in religious services and ceremonies to the women at Coffee Creek Correctional Facility, which is Oregon's only women's prison, and also into the men's prisons throughout the state. And what Red Lodge was seeing was that a lot of the women that they were working with soon after their release from prison were facing non-criminal legal issues that were going to have an impact on how successful they were after incarceration. And so coming out of law school, I started working with them with this idea of, can we screen women for these legal issues, and then set them up with an attorney after they get released to reduce some of their barriers. Very quickly on, we realized that even if we could screen people for legal issues, there were no attorneys to connect them with. So I was fortunate enough to receive a fellowship from my law school and was able to spend 1 year with Red Lodge piloting this idea of going into the women's prison and working with the women that they were working with before they got released, to see if we could reduce some of those barriers, or at least give them information so that when they were released, they could kind of hit the ground running on some of those issues to resolve those barriers. And the women that they were working with were releasing all over the state. And so, each of the counties has very different available sort of re-entry or social service supports. So this was a way to provide services when they sort of had some level of stability before they were released from prison. Very soon after starting to work with the women would talk with me about their criminal convictions and what happened in their criminal cases. And they would often say, I know there's nothing that you can do about this, but this is what happened to me in my criminal case. This is how I was involved in the crime in the first place. And I think more people need to know, because if more people know, maybe the women after me, this won't happen to them. And so it was very clear that in the stories that they were talking about, how they were coming into the system, how they were committing crimes, how they were treated during prosecution, there was a real gender component to that. It felt strongly like this was happening to them because they were women. This was happening to them because they were mothers. And so I was fortunate enough to, after law school, be able to, or after this pilot program with Red Lodge, be able to come to the Oregon Justice Resource Center, continue doing this work, but also build up this idea of a women's justice project where we continue to provide these non-criminal legal services for women inside, but we can also lift up their voices and their stories, because when we're talking about mass incarceration and criminal justice reform, women are still very often left out of the conversation. When we're talking about creating a system that's fairer and more just and more humane, a lot of times people are not thinking about women. And so a big component of the Women's Justice Project is to hear the women's stories, listen to what their experiences have been, and then use that to educate the public and policymakers. And so one of the things that the Women's Justice Project does every year is a Women in Prison conference. And we highlight issues that we're hearing from the women that we're working with that are of major concern. So last year's Women in Prison conference was around the issues of women who have committed crimes out of being victims of domestic violence relationships, or we call sort of the short term that we use are survivor defendants. And so we have 2 days of educating the public about that. When it comes to the intersections that we see around health issues, I mean, it's a little bit overwhelming because it's sort of at every point in the process. It started out with me hearing from women about how a lot of the times their crimes were committed out of drug addiction, alcohol addiction, or mental health issues or mental health crises. And that's sort of like the prime part in which I saw health intersecting with the women's lives and the criminal system. But the more that I talked with women, and the longer that I was working with people in prison, almost every single client I had some sort of medical condition that they were struggling with while they were incarcerated. And that was like the one area there where there was nothing really that I could help them do. So they were struggling with either a physical health issue or a mental health issue that they just couldn't get services from while they were incarcerated. And it was going to have an impact for them when they were released. Bobbin mentioned that we did some reports out. We've done a number of reports out of the Women's Justice Project, but the biggest one that sort of shows this intersection of health, women, and the criminal system came out of a survey that we did of over 140 women incarcerated at Coffee Creek, where we asked them about their experiences from arrest of their most recent crime all the way through incarceration. And we did this in conjunction with the Portland State University criminology professor, Mark Lehman. And when Professor Lehman got sort of the raw data of this survey that we did with women that sort of ran the spectrum of the criminal legal system, there were two things that the two top sort of trends that he saw in the numbers was, one, the history of trauma and how trauma impacted their lives and led to the criminal system. But the next really big piece that he saw was the intersection of drug addiction, mental health, and physical health issues for the clients that we were working with and the women that were surveyed. And so that's a report that's available on our website. They're called the Her Story Oregon Survey Reports, and it's on sort of trying to have a discussion and encapsulate just all the different ways in which public health in which health is intersecting with the women that we surveyed. So we see, like I had mentioned, drug addiction, mental health. We'll see physical effects of people's incarceration. Oftentimes women will talk about the food or the water having major impacts on their health while they're incarcerated. Injuries that they are having while they're incarcerated that lead to bigger problems because they go unresolved. And those are all now issues that they're going to have to deal with when they are released from prison. But I'll stop there. There's so much that I would want to talk about regarding health and the women that I'm working with, but I'll just kind of close there and pass it off to Juan.
Yeah, so we'll just ask Juan to talk about the Civil Rights Project, the work that you do, and the issues that you're seeing primarily in the jails and prisons. And if you wouldn't mind also talking a little bit about what we've been doing since COVID in the prisons, I think that would be of interest to a lot of folks as well.
Sure. Thanks for having me. My name is Juan Chavez. I'm an attorney with the Oregon Justice Resource Center, run the Civil Rights Project, and I use he, him pronouns. So I have, since law school, been fascinated with the way that we incarcerate people and really kind of personally investigating why it is that we do that in the first place and what possible societal gains we get from doing that. And it seemed pretty clear since law school that it's nil. I mean, we get what in fact we get out of this is not safety, but a continuous punishment machine that continues to chew up people and create more cascading social and health harms from public policy decisions. So how did I learn that? Well, in law school, I interned at a public defender's office down in Salem. I would often do the initial interviews on behalf of attorneys who were receiving new cases from Marion County. I'd say most of the people had one or two questions about, what's happening with my case, what's happening with the court system, why am I being held here, I didn't do the thing. All that did happen at the top level, but I'd say most of what I spent my time talking to people about was what was going on in the jail, what was going on in their day-to-day life as they're trying to survive and navigate this new environment that they're in. They could be simple questions about, when can I start working in here? I'm probably stuck here for a while. I'd like to at least keep busy. Or the food, I wasn't cooked and I feel really sick now. How do I take care of that? And I would take that back to the attorneys who were assigned to their cases, and they would say, "Oh no, that's not us. That's for the civil rights bar to take care of." So I was like, who are those people? Well, it turns out not too many in the state of Oregon. Not too many people are solely focused on prison and jail issues as a practice area, which isn't to say that a lot of folks aren't taking on those kind of cases in segmented manners, but I'd say that I'd probably count on one hand how many people just focus on prisons and jails in the state. And that seemed like a need that I could help fill. So I started just taking cases best as I can. I had some good mentors who helped give me cases. There was enough cases to certainly share and go around, and basically people who are working on these things know that what's going to move the needle here is building a capacity of taking on legal claims against either the Oregon Department of Corrections or local jails. And as happens when you take on a prison case, your name starts to circulate through a particular social group, and your name gets written down on some bathroom wall, and then suddenly you're getting a lot of phone calls. I didn't even need to put out ads or anything. It was right there in the facility. So what I heard day in, day out from people calling me either from prison or from recently being incarcerated was some issue that has to do with the medical care that they received. And what I think I eventually learned was we use medicine in America's jails and prisons as another form of punishment. You've probably heard it before, I bet you're really happy being in prison with your 3 hot meals, healthcare, and a TV to watch. You don't want this healthcare, and it's all part of the overall punishment apparatus that maintains control and discipline through healthcare rationing in large part, and sometimes direct retaliation that results in people not getting treatment and people not seeing an outside doctor and people being straight up sent to solitary confinement. Just let that sink in for a second. There are doctors who have threatened patients with solitary confinement if their patient talks back to them about whether or not they think they're getting adequate medical care from the facility or the doctor directly. I've talked to enough nurses and enough doctors in these systems that a lot of them know that this goes on. I think my ASL interpreter froze. Maybe that's on my end.
No, I'm seeing it too. Risa, are you able to step in? Thank you so much, Risa.
Okay, we good?
Okay, good.
Okay, apologies. So when you have people for whom have been punished by the system through, let's say, biased policing or racial profiling, and then were rammed through a criminal legal punishment system unfairly, or let's hypothesize, that some people, do commit bad acts. When you arrive in prison, you do have an expectation that you can pay your debt to society. This is what you're being told you're supposed to do. This is what you're told your way out of incarceration is, to wait it out, do your time, and don't commit any more bad acts. Well, what other lesson are you learning then by the fact that your doctors, your prison guards, everybody is conspiring to add on additional punishment to you that ends up compounding and ends up demoralizing you, and very often also keeps you further infirmed long after your release date, after you paid your debt to society. One of my earliest cases, I had gentlemen who had done several stints in the Department of Corrections and in different jails throughout the state, and we just had a terrible relationship. It was early on in my career, and I kind of had a beggars couldn't be choosers attitude as far as taking on new cases, and I was just struggling to really develop trust with my client, develop candor, and also try to avoid being abused by this guy. And I was trying to figure out why we were having so much difficulty. It took me far too long to realize he was in pain. He was in physical pain every minute of his day. And that pain started while he was incarcerated. It had gone untreated while he was incarcerated. And it put him in a position, once he was out of prison, to be only in a position to be able to manage his pain rather than have that prevented or not allowed to continue on. And that wasn't even, what we were suing over at that point. We were suing over a whole new injury, a whole new problem. But these things compound, and they just create bad social and health outcomes. So I worked on these cases. And there's other aspects of conditions of confinement claims one can bring in federal or state court. And Bobbin Singh of the Oregon Justice Resource Center reached out to me asking me to help start a civil rights project with OJRC. And that's how I'm here, which, it was obviously a great opportunity, and I was able to really kind of think bigger about what kind of advocacy we can do for the state of Oregon. I didn't quite expect for so many calamities to occur all at once in 1 year, like 2020, but here we are now. And what I'm seeing now with ODOC's COVID response is what I was talking about earlier. We are committed, if nothing else, to punishment. And we cannot separate the idea that these are people whom have committed bad acts and therefore are not allowed the dignity of medical care, allowed the dignity of prevention of negative health outcomes. And now we have either close to 1,000 or over 1,000 people who have contracted COVID-19. And as we're learning more and more about what kind of future negative health outcomes that could bring to a person, I fear what kind of spiraling social problems this could also bring. And these are all things that the state of Oregon knows, understands, and agrees with us on. But that's sit in for a second. The state of Oregon and the Oregon Department of Corrections agree that social distancing is the cornerstone of their ability to be able to combat COVID-19 in their facility. They also recognize that they cannot social distance their population without releasing nearly 5,000 people. Faced with that, they have chosen to do nothing. And we are now dealing with the consequences of that. As my co-counsel and mentor, David Sugarman, often says, it's not the disease that is incarcerated. The disease can leave the facility just as easily. And a lot of our prisons during the big prison building boom of the 90s they've been built in the eastern part of the state, often in small rural counties without adequate medical infrastructure for communities that might face an outbreak because they have a prison in their backyard. These are all avoidable problems, but we are, again, so committed to punishment that we're just left to litigate. And I don't think medicine should be administered by court. It shouldn't be determined by lawyers. It should have been determined by good health science, but that's ignored in favor of those who hold the keys to the facility. I'm going to turn it over to Alice if she has to get going.
Well, we're like so lucky to have both, Julia and Juan working with us, and bringing on Juan was especially exciting for our work because most of our other programs are more on sort of the receiving end. So we have clients that fit a certain criteria for our services, and then we provide legal services to that individuals. But often we would see these harms or these conditions that would exist, but didn't have an affirmative way of addressing those. And being able to have a civil rights project and a civil rights attorney like Juan and his team available to us, was exciting, and I think allowed our organization to do things that we just couldn't do historically. But like Juan mentioned, like we never anticipated that 2020 would be the year in which we'd be filing lawsuits almost on a weekly basis against either the city or the state for whatever reasons, whether it's law enforcement practices or condition issues in our prisons. And so it was really exciting to have him here. I just wanted to quickly introduce Alice. She has to leave at 5, but one of the big things about our organization that I think has been unique was we were one of the first sort of criminal justice civil rights organization to really invest in communications when we brought in Alice. I think we were the first civil rights organization to actually have a director of communications. And that is incredibly important to be able to not only talk about the work we're doing, but to help reframe the narratives that have been out there, because so much of it has been built on these past like tough on crime, law and order, type of narratives, which are all wrong. There's nothing actually supporting that. So the reason why I wanted Alice to talk is to talk more from like a communications perspective, like why having public health or medical professionals as messengers on these issues and sort of the lack of that voice, like how it could be important in moving the conversation, and just what communications means kind of like in our world right now, and what it looks like. So I'll let Alice introduce herself and just kind of talk about her work and the things that I just mentioned.
Hi, everyone. So I'm Alice Lundell, and as Bobbin mentioned, I'm the Director of Communication with the Oregon Justice Resource Center. I'm one of the few non-lawyers that works for the organization, and my role, as Bobbin described, is to help us talk publicly to a variety of different audiences about not only our work, but also to develop and even start conversations in some cases around issues in the criminal legal system and in the punishment system, prisons and so forth, which are often conversations that have been quite stagnant for a long time. I think even in the 5 years that I've been doing this work with the Oregon Justice Resource Center, we have seen within Oregon and nationally some development in terms of public awareness and understanding around some of these basic ideas that this approach of locking up more and more people that the US has been pursuing for 40 years is not productive, is very expensive, and is causing a lot of harm to people, but has not really achieved the goals that it set out to do of reducing harm, and in many ways has created a lot of additional harm. So what we are trying to do as an organization is to educate Oregonians and to provide access to information that is good quality, that is helpful, and that is kind of expanding people's understanding and awareness. An important part of that is looking for opportunities to bring the voices of the people most directly impacted by the system. So that's people who have been incarcerated, people who are currently incarcerated, family members of people who are or have been incarcerated, into the conversation in a way they often have had little opportunity to do in the past. It's frequently challenging for journalists to make connections with people who are in prison. There are a lot of barriers often for people in prison to communicate out to the world outside, particularly when those in positions of power within those institutions, like correctional officers, the leadership of those prisons, and ultimately the leadership of the Department of Corrections, are well aware of the potential consequences if an incarcerated person acts as kind of a whistleblower by going to the media and talking about what they're experiencing. And there is an all too present threat always of retaliation against people who are in vulnerable positions, like incarcerated people, if they speak out through the media. So a lot of my job is trying to help people to contribute to those conversations in ways that are safe and reasonable for them, and that respect the limits that they want to place on how they can feel comfortable speaking out. Because there is, I think, tremendous energy among people who are in our prisons to be seen as part of our community, which they are, to be heard, to have the opportunity to dialogue with people outside, whether it's other community members or whether it is people in leadership roles within the state. So part of my job is trying to help that to happen. So this year, of course, our work is being dominated by this issue of COVID in the prisons. And it has been, it has been challenging to try to communicate to people outside prison just how huge the scale of this problem is within the prison system. We're now at a point where we've had about 1,200 cases within the prison system. Of course, not all of those are active cases now. This is over the last 6 months. These cases have accumulated. But to describe, some of the letters that we've seen, some of the messages and conversations we've had with people, there is really quite a pervasive fear that people have. People are afraid of being next. They're afraid when they lie on a bunk at night, 2 or 3 feet away from a person either side and from a person below, that somebody near them is going to be infected and is going to spread it to them. People in prison are particularly vulnerable to disease spread, and COVID is no different, as I'm sure you can all appreciate. And so we have really tried in our messaging to bring across a sense of urgency, and also to contrast messaging that has come particularly from the governor's office around community safety and well-being, which has been about mask wearing, social distancing, hygiene, avoiding gathering in groups with people outside your household, which is of course a sensible and scientifically based messaging. And then how different that has been when it comes to the prisons. It has taken a lot of struggle on the part of incarcerated people, on the part of attorneys like ours and other people to advocate for mask wearing on the part of prison staff and masks being supplied to incarcerated people, hygiene standards being kept up. But some of the problems that we've seen, like the physical distancing, are things that really can't be achieved in the prisons. So what we have been trying to say through our communications is, look at this reality that we don't have enough space to keep people apart. We have to recognize the need to release people. And so far we've seen, maybe, I think we've had not even maybe 100 people released, which out of a prison population of about 13,000 is not going to do that much to prevent disease spread. So we have been, sadly, one of relatively few voices that is out there within the media and within the kind of public space in Oregon talking about this need for action, this need to protect public health and safety, the fact that the virus is not incarcerated and will spread out of prison if there is an outbreak in a prison, right? So the rest of us are not safe if we allow an outbreak within a facility. And that has been difficult to see how easy it has been for many people to overlook the voices of the incarcerated. And it's one reason why we're really delighted to have the opportunity to work with Oregon Physicians for Social Responsibility as another very credible voice to speak with us. And I do think it's important to understand just how much impact a medical, scientific, and public health voice can have in this conversation. Because when we speak out, we're speaking as a law firm. We can talk about the legal side of things. We can talk about the medical advice that we get from our advisors for the lawsuit that we're engaged in on this issue. But to hear from people who have expertise and can say, look, in the end, this is not about the reasons why people came into prison. This is about understanding the humanity that they all have, and the fact that people's punishment is not risking serious health consequences or even death, right? The punishment is deprivation of liberty. Prison is supposed to be a place where people are rehabilitated, they serve their time, and in almost all cases, they return to the community. So it's in all our interest to treat people well and to treat people humanely. And I do think that there are a lot of opportunities for people with medical or scientific or public health experience to be a voice within this conversation on COVID in the prisons that can advocate for taking the same understanding that we have outside prison of the need to protect the health of our community and applying that to people in prison. Because at the moment, sadly, we aren't seeing enough of that happening. We know there are more sensible things that can be done in the prisons. Unfortunately, there is a double standard that is often applied to incarcerated people, and that is putting at risk their health and the health of everybody who goes to work in our prisons as well. So I would really love to see more people from the healthcare field speaking out on these issues and working with us to expand this conversation, and particularly to engage with media around the reasons why it's very misguided and short-sighted to allow this disease to ravage our prisons, because this won't be a problem that just affects incarcerated. It's going to go much further. We've now seen 9 deaths in the prison system from COVID, and really in many ways we are just waiting to be notified of the next death, because sadly we just fear that there is no real sign of this diminishing as it stands. So thank you once again, all of you, for listening and for being willing to engage in this conversation and learn about our work and how we are trying to bring attention to this issue. And we've been doing this, since this pandemic really started.
Thanks, Alice. And, as I mentioned, we were one of the, we take pride in the work around our communications efforts. So like all of our reports, our social media, Alice, consults and supports other community organizations with their press releases and press conferences and things like that. So we try to be a resource where we can, both public facing and also privately to other organizations and around communications, recognizing that the skill set that exists with Alice is not one that that she's developed over the past 5 years working on these issues, but not every organization has that capacity. So we just feel really grateful to be able to have her part of the organization. I'll often joke that criminal justice reform has a slight British accent in Oregon, but I think the communications is really, really important, and taking control of the message, because again, so much of what we do in the criminal legal system is actually not supported with real evidence or social science or medical research. And for so long, the conversations remain superficial. And if we're able to get out a different message to say, there's actually a better way to do this, and here is science that supports it, we can actually be successful with that. And also understanding that this is an iterative process. Like what we know now will not be what we know in a year or 2 years from now, but we have to leave open the possibility for the criminal legal system to evolve and change based on our changing understanding of the world and human behavior and conditions. And that is the problem. Most of the stuff that we're doing right now has been rooted like in the 1980s and 90s and even older. And those are the principal ideologies and philosophies sort of still driving the criminal legal system. So just as to wrap up, as you can see, like all of our staff are basically hungry and excited about the opportunity to be able to work with OPSR and medical and public health professionals, because there's just such a need and demand for it. One of the things I did promise to identify or do is to identify several policy initiatives that I think are ripe for a change. I think first and foremost, I'm not sure what the status of this is, but DOC doesn't actually have digital medical records. So that's something that we could use a lot of help with as far as pushing the agency to transition, if they're in the process or if they've committed to do it, making that happen faster and with transparency. And so that way they're actually transitioning into a system that can be useful. I mean, one of the things that we just are not familiar with or unclear about is like these lists that they're creating for release that the governor's asking for, is we don't know how they're creating that, how they're identifying medically vulnerable individuals, because their records are paper records, and how are they actually, what database are they using, what systems are they using? A few other issues that have popped up is we have a compassionate release statute here in Oregon. It's an early medical release statute, but it's actually, if we were actually to say that it's compassionate release, it actually has very little compassion in it. The number of people or the kinds of people who are eligible for it are very limited. So it has to be basically a nonviolent offense. It has to say in your judgment that you're eligible for early medical release. And basically you and the Board of Parole has to make the decision about what constitutes a medical condition that that can count towards this. And basically what it comes down to, out of a population of 13 to 14,000, only hundreds of people are eligible. And quite honestly, the people who are most deserving of compassionate release tend to be those individuals who have served very long sentences, that have committed these person crimes like early in their life when they were young, but are now like in their 50s, 60s, and 70s, that basically have almost a 0% chance of committing any type of additional sort of offense or anything like that, but they are ineligible for this type of release mechanism. And so with the COVID situation, what's ended up happening is 95% of the power is actually with the governor through her clemency for release. About 3 or 4% is with the Board of Parole through traditional parole mechanisms, which is a convoluted process and not extraordinarily fair. And then through the early medical release statute, which is very, very limited in what it can do. We actually tried to get the Oregon State Supreme Court to mandate the Oregon Board of Paroles to be more aggressive and more broad with their interpretation of what constitutes eligibility under the statute. But the Oregon State Supreme Court didn't take our case. So we're now looking for other ways to potentially work around that. But the easiest fix would be a statutory fix in which we allow the medical advice actually dominate the decision. Public safety is always a balancing factor in all these release decisions like this, whether or not the person's has a likelihood of reoffending or whatnot. But the dominant thing that has to control that decision is medicine and public health. Like, what is better for the individual? What makes sense for the Department of Corrections? Is this person going to be better off in the community? And what we're seeing with the deaths is most of the deaths are elderly individuals. We have one of the highest numbers of elderly people in our prisons as a percentage in the country. And that is going to cost more money. It's going to result in more medical issues, and many of them don't need to be incarcerated. The other issues that we're deal with what Julia mentioned, survivor defendants. So women who have committed criminal acts out of relationships that have been where they have been involved, where they're a survivor of domestic violence. So there's things like that where, with Senate Bill 1008, we're really able to use brain development and medical research and social science to show how youth are different from adults. And that was really what we were able to keep the conversation focused on that, and actually able to pass historic reforms around youth justice in 2019. And we're hoping to do the same with women. But there's tremendous opportunity, I think, with populations that have intellectual disability and mental health issues. I mean, mental health is one of the biggest issues and addiction issues with incarcerated people. So those are always things that we could work on. The last thing that I'll mention before we can open it up to question and answers is the issue around the death penalty. I mean, it's an issue that we work on prominently. Right now, there is a moratorium. We are trying to get Governor Brown to commute Oregon's death row and just be done with this. On average, we spend millions and millions of dollars allowing these cases to go through the appellate process, understanding fully well that no one's going to be executed in this state. So it's just a charade. And the only way we can actually get rid of the death penalty is through a ballot initiative, because it's in our Constitution. And that's expensive and laborious, and it takes a lot of resources. The easiest thing would be to have Governor Brown just commute everyone sentenced to life without parole sentence, which he has the power to do, and just sort of be done with this. And the death penalty laws have been rewritten in such a way that it's unlikely that we're going to get any new death sentences anytime soon, just because it just requires now really extraordinary actions to be eligible for the death penalty. But those are some of some bigger policy things where I think there's a lot of opportunity for medical professionals. I mean, what we'd really like to see is the early medical release statute and digital medical records. I mean, those are the two things where I think, like, next legislative session, if we could really find some legislators to support us. And there are some, I think, great people coming in to the legislature, just starting, like Dr. Bernstein, Dr. Dexter, was it Dexter? Is that it? Yeah.
Maxine Dexter, yes.
Yeah, Maxine Dexter, sorry, I'm getting my names confused. And then Dr. Lisa Reynolds, who will take over in January. So I think it's really great to have medical professionals in the legislature. I think it's really great that, we've had, I think, really positive conversations with both, and both seem very interested in our work and work around mass incarceration. So I think there's a real good opportunity to be able to bring in new voices from the legislature around these issues, and one that can help us guide us away from the other sort of nonsense that has dictated or pushed criminal justice conversations for so long. So those are just some basic ideas. I mean, we have dozens and dozens of other ideas that, you know, that are available for reform. Is that I think engagement from communications. The biggest sort of volunteer ask that we could ask for is being able to talk with medical professionals around cases or issues that we're seeing. I mean, for Julia, she has women clients that often have medical issues, and just to be able to talk to someone about what are the medical issues, like what does this mean when I'm looking at this medical record? And for Juan, especially for civil rights cases, being able to have medical professionals available to review cases and kind of figure out what the standard of care and practice are, incredibly important. And I think with COVID, one of the things that we are looking for is epidemiologists to help us sort of review and understand, you know, the conditions that currently exist and how DOC is responding and kind of consulting with us. So those are just some basic asks and ideas that I put out there as seeds, hopefully, that will flourish with you. But I'll just leave it there and leave it open for a question and answer. And Julia and Juan are still here, so I'd encourage you to, you know, ask them questions as well, because they're the ones that actually do the direct services, whereas I get to just like stand on soapboxes and ask for money. So
we do have 2 questions, but I thought if you all could take maybe 2 minutes to just so this week we're putting some effort into calling for an independent review of the evacuations recently because of the wildfires, and maybe if you just wanted to touch on that just for a second.
yeah, I'll keep that brief. So I think 2.5 weeks ago, what is it? 4 prisons were evacuated due to the wildfires. So 3 of the men's prison and 1 the women's prison. The 3 men's prisons, Santiam, Mill Creek, and OSCI, were evacuated to the Oregon State Penitentiary, and the women's prison, Coffee Creek, was largely evacuated to Deer Ridge. Coffee Creek consists of both minimum and medium, also an infirmary that housed positive COVID individuals from around the state, so men were there. And then also it has an intake center where everyone coming into the prison system goes to Coffee Creek first before going to an institution. So all those individuals were also evacuated to other prisons as well, like CRCI or OSP, depending on what sort of, what population category they fit in. But the women were largely evacuated to Deer Ridge. What we have heard, and likely you've heard through media, media around this, is the evacuations resulted in what we believe were a humanitarian crisis. The conditions at OSP and also the transportation of individuals out of the prison, especially the women, out to Deer Ridge, and the conditions there were conditions that were horrible, I think extraordinarily brutal. And it's unclear to us actually the totality of what happened. DOC is minimizing it and glossing over, I think, the types of things that happened and the experiences people had. More and more we talk to individuals, the more traumatic it was, the more things we're hearing that just are problematic. And more than anything, it was the population sort of commingling between all the different institutions without any COVID protections throughout that process. Now, we understand DOC had to move people because of fire safety, but it was done in such a way that was, I think, problematic and scares us as setting a precedent of how we treat individuals and individuals in custody during emergency situations. And so we, with OPSR, have jointly called for an independent investigation into the evacuation. So the hours leading up to the evacuation, what happened during the evacuation, and the week after the evacuation, after people were returned back. And we were already seeing positive COVID cases at OSCI, which didn't have any before. And I think it was a result of that commingling of individuals. And so we're putting a lot of pressure on legislators this week to move forward with that independent investigation, and also with the governor's office as well. And so that is something that we want. And as each day passes, the independent investigation becomes harder and harder. Like we're in a situation where we need this to happen as soon as possible, because the rhetoric we're hearing out of the Department of Correction, to me, is very problematic. They're basically saying no one went missing, no one died, and we know there were lessons that needed to be learned, that there were lessons learned. And so we won't talk about those lessons learned now, but we know that there were some bad things that happened, and we'll get to it. So that in itself is not okay. We need some transparency and some honesty and accountability about what happened, and to make sure it never happens again.
Thank you so much for giving us that update. And then, so the first question we got was through email before the webinar. What can DOC employees do to help beyond the day-to-day actions of acknowledging the humanity of those incarcerated and wearing masks?
I'll let Julianne Wan answer that.
Well, let me see. Oh, can I hear the question again? Apologies.
No problem. What can DOC employees do to help beyond the day-to-day actions of acknowledging the humanity of those incarcerated and wearing masks?
Yeah, I know that a lot of people end up working for ODOC for a variety of reasons. And not everybody who works there is a correctional officer, and not everybody who is a correctional officer is necessarily a bad person. What I think is just true from the top to the bottom is that there's a commitment to a theory of social safety, social well-being, and social health that runs through punishment. And so you can be, an outstanding person, outside of the facility, but the simple fact that you're enforcing a type of control over somebody, it leaks into most interactions that people have throughout the day. And you have people who, to avoid getting in trouble, have to walk on a specific colored line on the floor. And that kind of, power and authority creates a terrible dynamic that I think is hard to break, even with the best of intentions. That said, I have a number of clients who were saved, I'd say, by the correctional officers demanding that the health services people actually take a look at people. It's all, I think, a struggle under these circumstances to acknowledge the humanity and the dignity of the people that are incarcerated, and try not to lump everybody into a similar crowd, and really just try to, again, recognize everybody's humanity, which I know your question has posed, what can they do beyond that? I think that that's a hard one. That's a really hard one. Because again, frankly, there's a million moving pieces in these facilities, and I know that is something that they say regularly. I can have the best laid plans as far as how to keep somebody safe, but they didn't account for one bad gang interaction this person had years ago, and so now this person's getting pummeled in the chow hall. I think really every correctional officer, every employee needs to consider talking to their bosses about how do we get people out of our facility. Mm-hmm. We've had actually, here's a recent example. Even the head of the correctional officers union wrote a letter to the Oregon legislator regarding social distancing, COVID, et cetera, stating how at facilities like the Oregon State Penitentiary, they've been building, dormitories that were supposed to be temporary just to, fill in some needs there that just became permanent. And so now you have people stacked upon each other in places that were not intended to be dormitories. And that's something that I think, or the Department of Corrections has never said, no, we need to proactively think about the people that we have in our custody already and advocate to change the laws regarding sentencing, regarding how long people need to be chained into their facilities, and really move towards getting people out. Rambly answer, apologies.
think I'll just chime in, sort of in the similar sort of vein of what Juan is saying. The question was, you know, other than masks and treating people with dignity and humanity, but I do think that those are so core and so central to what is creating so much suffering for people inside, and especially around the question of how, are we treating people as people? The thing that, you know, this is such a stressful and chaotic time for people inside. Protocols and rules that they're supposed to be following and circumstances are changing on a day-to-day, sometimes an hour-to-hour basis. And there's just so much panic and fear that is piled on to this general understanding that or expectation that people inside are not going to treat them humanely. And so I think there's just, you know, other than, you know, treating with humanity, I do think that we're not even there yet. So that's such a core piece. The other thing that has been really tough for folks is they are not getting any really good information. So one of the things that Department of Corrections tends to do is just hold information. And I don't know, a lot of times everything they do is with this idea that it's for security. We have to do this for security and safety. But really what that's doing for folks right now is just creating so much more chaos and fear, and people are responding out of that. So it's just creating this compounded like chaotic situation where the rules are changing on an hour-to-hour basis, and people just want to understand, what should we expect? Why is this happening? What's going on? And if somebody would just sort of, if an officer would calmly explain to them, you know, this is what we have planned, this is why we have to do this, there would be so much suffering alleviated. And I think that goes back to treating people as human beings, not as just treating people as human beings. It's just such a core part of what's going on right now and why it's so tough for people inside.
Yeah, I mean, just to build on both those points, I think the humanity thing is sort of where we're unfortunately still at. But I think two things that CEOs can do, or people that work in corrections can do, is speak out. I mean, quite honestly, like when we talk about COVID in the prisons or these healthcare issues, it's their health too. At the end of the day, they are susceptible and vulnerable to this disease, and we don't know the long-term consequences of it are. We do know that there's an education issue as far as, unfortunately, I don't think everyone that works in correction actually believes COVID-19 is maybe real or the seriousness of it. And so I think there's an effort, an obligation on Department of Corrections and those who actually care about this to help inform the people who work there about the seriousness of this and how lethal it can be. But again, like, you know, the medical experts that we've spoken with, we just don't know the long-term impacts of this and what it means for people's pulmonary functions or other health outcomes, you know, in the long run. And I think that's the thing that's really scary. I think the other thing that officers can do, or people in corrections can do, aside from speaking out, is, I mean, I guess it's the other side of speaking out, but work with the unions to help around these issues. I mean, better conditions in custody, and better treatment of individuals, like Julia was saying, like better communications where people feel informed, will lead to better conditions, a safer work environment. I mean, that is ultimately what we're talking about. Again, the well-being of everyone inside that live and work there. You know, we unfortunately are limited in our ability to be able to work with CEOs or the union just because, you know, they're technically a represented party because we're litigating against DOC. But if we had some more staff allies that could really help advocate and speak out and talk about the conditions, I think would be really good. I guess the last thing is this cultural thing that we see with DOC. You know, as Julia and both Juan has sort of highlighted, we're in unprecedented times. Like, the conditions and circumstances of our world is nothing like we've ever experienced in modern history. The Department of Corrections seem very committed to getting back to normal and explaining to stakeholders and decision makers how well they're managing this. I think if DOC from the outset were to say, look, we're a prison, we're not built for this, we need help. There are hundreds of experts out there, from civil rights advocates to medical professionals, that would come to the table and provide thoughts and suggestions and help with trying to figure out how to navigate through this in a communal way. But so far what we see from DOC is this real reluctance to have outsiders sort of look into what it is that they're doing and how it is that they're operating, and for anybody from the outside to have any input. So the more that we can kind of try to open up the veil of sort of secrecy that exists and make things more transparent and less opaque, the better.
Thank you all. And then our next question is, we at Oregon PSR sent a letter to Brown. Do you think a petition from health professionals would have any clout?
You know, it's hard to say. Like, you know, we've seen petitions go to the governor and it hasn't really moved her. I think at this point, probably the most persuasive thing is more public. So if there was a petition with like more public statements, more medical professionals speaking out, you know, through the press, or, you know, doing more public speaking events like these Zoom webinars and things like that, will be more helpful in putting more public pressure on the governor. I think the more public pressure from medical professionals will actually be beneficial in the long run. But yeah, I think that voice is the thing that could help turn the tide on this. I don't know, Julia, Juan, if you have any thoughts on that.
I think you said it.
And then the next question is, what happened to the request for an investigation in the Judiciary Committee?
So that request was received, and there are legislators who are very interested in wanting to see that happen. And right now it's just politics about getting enough legislators who know how to make this happen. I think in part it's going to require action from the governor, because the legislature would have to go into special session to do something, but the legislature could put pressure on the governor to help make this happen. And that's what we're trying to sift through this week, is trying to understand what are the political realities and barriers that exist in order to make this happen. But there are legislators who are interested in wanting to see this happen and wanting to understand what happened during the evacuations, because their concerns are as equal to ours, both in, you know, like the quality and nature of it.
Great, and that's actually the end of our questions that we have. But if anybody wants to ask one in person, feel free to use the raise your hand option, or probably going to wrap it up here in a minute. I did definitely want to thank everybody for speaking, and also kind of wanted to touch on the first question as far as the humanity piece. I was actually at a graduation ceremony in January at Coffee Creek for a loved one that's incarcerated there. And, you know, it was a small group of women graduating in a parenting course, and they each gave a little bit of a speech. And I actually really, I started crying because each speech was begging for, you know, I know I've made mistakes, but just begging for humanity. And it really was, you know, these women had worked hard. They had done everything they were asked to. And I felt like, you know, how far down do you have to be pushed to be begging for this humanity at a graduation that was put on for you and your accomplishments? And so just really emphasizing that piece of, like, you know, and even there, I probably even should have expressed that, you know, to everybody, that just, you know, you all are worth this celebration, and nobody should have to beg for this kind of humanity in this moment. And so, but just, yeah, all of us kind of just need to be a little, I think, pay a little bit more attention to what's going on in there, and that punitive, you know, that it's such a culture and it's such a system in our prison walls. So yeah.
I mean, I do want to emphasize that point. I mean, at this point, what's happening is individuals in custody and their family members are begging for their lives. They are begging to be seen and respected as fellow Oregonians. And there's nothing more, I think, painful than watching people literally begging for their lives right now, and no one responding, not the state, in any meaningful way. And I think it is really, really unfortunate. I mean, it's understandable that the state is going through its own kind of transformation, and there are a lot of people hurting for a variety of reasons. But we can't forget those people who are in custody. The long-lasting trauma and injuries that are going to occur from how we're treating people are going to ripple through generations, and both the moral, psychological, physical, and fiscal costs to all of it are going to be just profound. But it is quite astonishing to see basically a humanitarian crisis sort of unfolding in slow motion in front of us, and really very little urgency in responding to it.
Yeah. Looks like there's, we've got a couple minutes left, and it looks like there's one question from Lisa Reynolds, and looks like Lisa typed it into the Q&A box. But Lisa, I'm going to allow you to talk in case you'd like to go ahead and say it, and then we'll respond to it.
Great, thank you, thank you. Thanks everyone, thanks. This is such important work, and I've been thinking about this whole humanity. I won't go on too long, but I mean, obviously toward the incarcerated, but I think it's the same towards the impoverished, towards people of color. There's this trying to distance yourself, other yourself from these people who are really suffering. And that's, I think, allowed us to have policies that continue to dehumanize those populations. And my question is a little bit off topic from the medical, but you know, this latest news about Governor Brown kind of federalizing law enforcement, which she did temporarily for the Proud Boys, although we're calling them the Sad Boys today. No, they're still awful. The Proud Boys. It was just shocking to have her extend that. And I know that's probably a big question, but you know, what can we do to make very clear that this is not the right thing for our state?
Yeah, I mean, I think, and I'll let Juan also chime in as well, and Julia if she wants to, but you know, what I want to do is actually kind of broaden this up to a bigger thing that we're seeing with the state. You know, with COVID, with the racial justice movement that's going on right now, with the wildfires, with all these challenging things that we're facing as a country and as a state, what we're seeing is the true value system of our society kind of emerge and reveal itself. And I think what we're seeing, unfortunately, it's very tragic. It's very sad. We're seeing a culture that punishes and dehumanizes across the board. You know, whether it's people on the streets or whether it's people in custody. I think if you're on the margins, you are you are in the crosshairs. There's no other way to put it at this point. Like, it feels like your life is in jeopardy in some way. And while you're talking about the federalization of law enforcement, I think the danger that we see and that's being set from police and the governor's action with law enforcement all the way to the prisons is in emergency situations. This is where we really began to see the erosion of civil rights and liberties. Like, we give power to the state to do things in emergency situations because of the emergency situations, not thinking of the long-term consequences of the power that we're willingly giving up to these actors. And I think that is what happened. Like, there was I think a fear that there was going to be a lot of violence in Portland over the weekend because of the groups that were coming together. The governor, I think, attempted to step in because she felt like there was a lack of leadership within the city, and wanting to help support, you know, people of Portland with this, with the Proud Boys coming in. But without actually slowing down and talking with like the civil rights community or advocates or other people who understand these issues and thinking 2-3 steps ahead, you know, by federalizing law enforcement, now we find ourselves in a situation where even declaring a state of emergency, a security apparatus in which we can't even figure out who's in charge anymore, like on the streets. And that has created an inability to hold law enforcement accountable. And what we saw from Saturday is an escalation in the aggression and violence of law enforcement, because they full well know that they can just basically do anything at this point, and it's almost impossible to hold them accountable. But I think that parallels what we're seeing in the prisons and what we're seeing with the evacuation. We have given so much deference to the Department of Corrections and Colette Peters that they can do anything at this point, essentially, quote unquote, create a refugee camp, and no one blink an eye. You know, and because it's an emergency situation, and if we do not challenge that, if we accept that, we allow things like that, say a next wildfire or flood or snow conditions, for people to be thrown in these very deplorable conditions, and for us not to even think about it. And that will percolate out to the rest of the community. If a town has to evacuate, if a community has to evacuate, those expectations ripple out. You know, when we create a floor, the tendency of our society is to regress to that floor in all situations. So it is incumbent on us to be able to look and reflect upon how we're treating those on the margins, or those with the least power, because ultimately that is the reflection of our values. So, just to broaden out your answer, sorry, this is the thing that's been frustrating and angering me so much over the past couple of weeks, is the willingness of our elected leaders to just give up the power to police and state actors that are solely responsible, that have the monopoly on violence in our state. And we're giving them more and more power each day, which doesn't make any sense under the current circumstances. So sorry, that's my soapbox. I'll let Julia and Juan chime in if they want to.
And I'm sorry to interject, but we are going to need to wrap up because our fantastic ASL interpreters have been working really hard, and I want to be able to give them the rest of their evenings. But anything that we'd like to say to wrap up before we all log off? And I'm going to put the social media and websites into the chat in case folks are not signed up for email alerts and following us on social media. But yeah, any final comments?
I just want to have one short final comment building off of what Bobbin is saying in terms of the deference that we're giving. And we're giving this deference to state actors who continually, repeatedly show that they need help. They're making a lot of decisions, poor decisions over and over again. And there are people in the community that are making themselves available, that have an expertise in certain areas, whether it's about what's the criteria for who the governor should be releasing, whether it's reaching out to public health and medical professionals about how do we create an evacuation plan that makes sense during COVID. But over and over again, we keep focusing in on just that one incident, saying it was an emergency situation, and we are failing to look at the bigger picture of seeing the pattern of this poor decision making that is not an uninformed decision making.
Thank you for highlighting that, Lisa, too. I often say just because you don't see the prison walls doesn't mean that you're not living in a carceral state, and that is so true for so many marginalized people. So that's my final comment.
Well, and I think that in terms of public health, COVID-19 has taught us that we are all connected, even when we don't see those connections to each other, right? And so hopefully a lesson we can all learn and take to deep heart is that we need each other, and we need each other to be treated with dignity and care and respect.